Good day, sir. I am Cristel Maricanoy, and today I will demonstrate on how to assess our nose. Our nose is a part of the body which filter and humidify the air we breathe. Good day, ma'am. I am Cristel Canoy. I am a student nurse. What's your name, ma'am?
Cyber Grace Alejandro.
Okay, so today, ma'am, i-assess na ko imong nose, ma'am, ha?
Okay.
Okay, so prior to this is perform medical hand washing. It deters the spread of microorganisms. Next is to gather all the equipments needed near the patient to save time and energy. Next is to provide privacy to the patient so that they won't feel embarrassed. And by doing that is to close the door and the curtains. Next is to inspect the external nose for any deviation in shape, size, or color, and flaring or discharge from the nares. When we say flaring, it is the widening of the patient's nostrils, indicating that the patient has difficulty in breathing. Okay, ma'am. Hangad na may, i-check lang nato yung nose. Tuko ta, ma'am. Hangad, ma'am. Okay. It is normal when it has uniformity in color, symmetrical, no flaring, and the septum is not perforated and straight. Next is to lightly palpate the external nose to determine any areas to tenderness, masses, and displacements of bone and cartilage. Okay, ma'am, gunita na kami ilong, ma'am, ha? Check na ko, ma'am. Okay, ma'am. Okay, when we assess, we are checking if the patient will feel pain when we palpate certain areas of their nose, at the same time checking if there are lesions present to their nose. Wala kay kana na feel sakit, ma'am, katong gianan ako imong ilong?
Wala.
Okay, next is to determine patency of both nasal cavities. So to do that is to ask the patient to close their mouth and exert pressure on one nares and breathe through the opposite nares. Repeat that procedure to assess the patency of the opposite nares. Close na to itong mouth, ma'am. Tapos, gunitan ako dali, ma'am. Inhale, exhale ta, ma'am. Pikas, ma'am. Inhale, exhale. Wala ba ka nalisod sa paghinga, ma'am?
Wala.
Okay, when we are assessing if there is no obstruction on each nares, it could be mucus, which could be an acute rhinitis or just an allergic reaction. It is normal when it is symmetrical, no discharges, no nasal flaring, straight nasal septum, and not perforated. Also, it is normal when she feels, when she does not feel any tenderness or no lesions noted. As of the moment, my patient has its air moves freely in her nostrils. Next is to tip the head back and inspect the nasal cavities using a flashlight or pen light on your dominant hand. So I have my pen light here, and ma'am, hangad tagamay, ma'am. I-check na ako ang bangag sa iyong ilong, ma'am, ha? Okay, pikas, ma'am. It is abnormal when you observe redness, swelling, growths, and discharges of the nose. And the normal assessment is when the mucosa is pink, clear water discharges noted, no lesions or growth noted. Next is to observe for the presence of redness, swelling, growth, and discharge of the nose. Check na to sa ma'am. Okay, wala may mga discharges sa inyong ilong, ma'am. Wala may mga sipon-sipon. Okay, next is to inspect the nasal septum between the nasal chambers. The normal one is it should be intact and midline. The abnormal one is when the deviated septum is noted and also when you observe perforation. So, check na to, ma'am. Okay. Next is to palpate the maxillary and frontal sinuses for tenderness. The frontal sinuses is apply direct manual pressure upward towards the wall of the sinus. Wala kayo na-feel na pain, ma'am, or sakit?
Wala.
Ani, ma'am? Naisakit, ma'am?
Wala.
Okay, for the maxillary sinus is apply pressure towards over lower edge of maxillary bones. Kani ma'am, naay sakit ma'am?
Wala.
Kani ma'am.
Wala.
Walay sakit nga na-feel? Okay, it is normal when the patient won't feel any tenderness. If the patient will feel tenderness, that is abnormal and they might have chronic sinuses due to the fullness of mucus. Next is to document findings in the client's record. And if you're done, inform the patient if you're done assessing. Okay, so mana po og assess sa imong notes, ma'am. Ang nose, ma'ams, ang imuhang nose is completely normal, walay mga burot-burot, walay kanang mga any abnormalities sa imuhang nose, ma'am. So, thank you for cooperating, ma'am, and yes, I'm done assessing. So, once again, I am Crystal Maricanoy, assessing the nose. Thank you.